Established in 1991 by the Society of Gynecologic Oncology, or SGO, the foundation is recognized as the preeminent resource dedicated exclusively to advancing awareness, education, and research on behalf of women and other stakeholders impacted by gynecologic cancers. We recognize that these diseases touch all aspects of a woman's life: physical, psychological, social, and vocational. Its all-encompassing nature requires an all-encompassing approach. We embrace the philosophy that knowledge is power. Through diverse educational programs, a nationally renowned website, awareness campaigns, and a highly respected research program, we empower women to be their own best advocates. Our objectives are to 1. Increase public awareness about gynecologic cancer prevention, early detection, and optimal treatment through our Learn, Listen, Act multimedia outreach campaign. 2. Facilitate education through live survivor courses, tele-workshops, our website, and brochures to help women and their loved ones learn the most up-to-date, evidence-based guidelines in the treatment and management of gynecologic cancer. And 3, expand our renowned research grants and awards program to advance scientific discoveries of new treatments and the eventual eradication of these below-the-belt cancers. To get there, we need more staff and funding to expand and promote our existing programs. We leverage a complementary relationship with the Society of Gynecologic Oncology, our professional society. These specially trained physicians are members of both organizations and volunteer their expertise and leadership to advance our mission. They serve on our board and various committees, oversee and approve all medically based content that's disseminated to the public, and volunteer their time as faculty presenters for our educational programs. We're also the only national organization dedicated to all forms of gynecologic cancer. No other organization exists that provides the breadth and depth of programming we offer on each type of reproductive cancer. We have a proven track record in coordinating and implementing comprehensive, evidence-based educational programming. Our signature education program is our half and full day gynecologic cancer survivor courses. We administer up to 10 of these courses annually throughout the country in collaboration with prestigious medical institutions and led by our expert SGO physicians. These free courses consistently receive positive reviews by the women and loved ones who attend. As a national organization, another important strategy we employ is disseminating a wealth of information through our comprehensive website, which offers improved navigation and interactive features. We survey participants after our survivor courses to measure overall satisfaction with the experience and the quality and usefulness of the information provided. We evaluate our research grants program by the number of funded researchers that remain in the field, the amount of additional funding secured as a result of our initial stimulus funding, and the level of productivity of our funded researchers. We measure our awareness activities by how many individuals and organizations interact with our staff, website, and social media, as well as how many people attend our programs and financially support the foundation. We're periodically misidentified as a service provider rather than a patient advocacy organization. We're often asked to provide financial assistance to women whose care is not covered by insurance or who lack commercial health insurance. We refer these women to appropriate resources for assistance. Also, the public sometimes assumes that breast cancer is a primary focus of the Foundation for Women's Cancer. We provide information about the links and hereditary factors that connect breast cancer to ovarian cancer, but don't dedicate resources to breast education, awareness, or research initiatives. We're proud to report a significant return on investment with respect to our research program. 94% of our award recipients remain involved in clinical research. $58 million in extramural funding was awarded based on initial research grants totaling $2.5 million, a 23-fold return. And 325 peer-reviewed publications have been attributed to research begun during the original grant period. Other notable accomplishments include the coordination of more than 60 survivor courses in 25 states, reaching 6,000 survivors, and the establishment of the National Race to End Women's Cancer, a movement weekend uniting 5,000-plus survivors and other stakeholders in raising awareness and funds to defeat gynecologic cancers. We compete with organizations that exclusively focus on breast cancer. It's challenging to gain visibility for below-the-belt cancers that have smaller numbers but are far more lethal. Government and private funding has been disproportionately directed to the fight against breast cancer. Also, like breast cancer before the 1980s, gynecologic cancers aren't something women feel comfortable talking about publicly, and we've worked hard to change that, including sharing experiences of celebrities like Angelina Jolie. Additionally, we compete with women's tendency to support their local doctors and institutions instead of our national organization. We'd expand the focus of our research grants and awards program to multi-year interdisciplinary awards that offer greater promise for breakthrough discoveries that improve the quality of life among those affected and will potentially eradicate these diseases. We'd also invest in novel and cutting-edge approaches for disseminating awareness and education initiatives to enhance our ability to reach all women and the public with messages that help them learn the symptoms, listen to their bodies, and act by seeking care first from a gynecologic oncologist. With more support, we could provide programming that's more equitably dispersed among the different types of gynecologic cancer. Uterine cancer is the most common type of gynecologic cancer, but our research grants and educational programming has been largely focused on ovarian cancer. Other gaps we could fill include more programming for medically underserved women, such as women in rural areas and Black and Latino women, more research for endometrial and cervical cancer, and the ability to reach all women in America, not just those diagnosed with a gynecologic cancer, regarding risks, preventive steps, and opportunities for early diagnosis.